Hi, everybody. Welcome. We're going to start here in 1 minute. If you want to use the chat box, you're automatically muted, but you can use the chat box. You can tell us what part of the state you're from, what the weather's like today. We'd love to know that. We're in Iowa at 75 and humid and going to be partly cloudy. So that's kind of how it goes here. We'd love to know where you're located. If you have questions throughout the presentation, feel free to put them in the chat box or the Q&A. We'll try to either stop and answer if they come up right in the middle of something. We can do that. We're pretty flexible, or we'll try and answer them at the end. Either way, we'll want to make sure all your questions are answered. Sunny and warm. Is that Erie, Pennsylvania? Is that right? Cool. All the way to yes. Got it. All right, we have so much to cover today, so we are going to get started. First, I want to thanks to Florida Department of Health for bringing Count the Kicks to the great state of Florida. Thanks to Nancy Travis and the whole AWHONN team who really helped coordinate this very quickly, and so we're super excited to be here. Before we get started, just a couple housekeeping things. This is being recorded. After this is over today, later today or tomorrow, I will send out an email with the recording, with a link to the slides you can download. I'll also send a couple other links like an evaluation and things like that. This is not CE certified or anything, but you can get a participation certificate if you want to request one from me. You certainly can. And with that, I'm going to turn my camera off, and so is Jen, just because we have a lot of videos to cover. And I just want to make sure like broadband Wi-Fi is not an issue, or we don't hopefully have any technical issues or anything like that. So with that, we are going to get started. So again, my name is Megan. I'm the program director with Healthy Birthday Inc. Count the Kicks. I'm excited to be here today. I'm excited that you took time out of your days to listen to us talk for an hour about something we are so passionate about: saving babies from preventable stillbirths. I've been with the organization for 2 years. Prior to that, I worked for Iowa Department of Public Health in tobacco prevention, education, and control. I'm very passionate about systems change, workflow change, to make things easier for you. I'm passionate about prevention and education. I have 3 kiddos of my own, so this is near and dear to my heart. I love working on this. I love sharing about this, and I hope that you will walk away knowing the passion that we have, that's more of a catalyst for you to begin doing this in your location, or if you already are doing this, other ways you can really incorporate it to make it even easier to do, and hopefully just maybe you'll learn some things you didn't know before. And with that, I'd like to throw it over to my colleague, Jen, who's joining me today.
Well, welcome, welcome. We're super excited to have you. My name is Jen Rowry, and I am the Associate Director of Engagement. I have been with Healthy Birthday for the past 3+ years, and I focus a lot of my attention into building partnerships, giving presentations, but especially near and dear to my heart is running our ambassador program and volunteer program, and just engaging individuals to help them come alongside this important cause. My background is in education, and so I'm extremely passionate about the concept of educating and empowering women and all kinds of healthcare providers so that we can work together to save babies. Thanks, Megan, for having me.
Yeah, of course. And before we dive in too much, I always like to play a Good Morning America video. And I like to play this video for a couple of reasons. One, it's just a feel-good story. It's a baby save. It's baby Ruby. She was saved in 2017 when her mom noticed reduced fetal movement. So I just want to start off with a feel-good video. I also like to show it because it does a really good job of just quickly showing you more about the app and the importance of this campaign. And then 3, I tend to reference this, or Jen will reference this video throughout the presentation. So it's just a good starting point for everybody. And so with that, I'm going to go ahead and play it. You'll notice it's slightly delayed, but it should still be okay for you to listen to and watch.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So yeah, just a good, feel-good video for you this morning. And so let's dive in a little bit about stillbirth and the data and the research behind it, stillbirth prevention especially. I know you all know this, you're all nurses, you're all in the medical field, but what I really want to point out here is the 4th fact down where it says, on average, 23,500 babies are born still every year in the U.S. And when you look at infant mortality, on average, around 22,000 infants die every year in the U.S. And what I'm doing is I want to call attention to the fact that we are losing just as many, slightly higher, more babies to stillbirth than we are to infant mortality. And that's not to underscore any of the prevention methods that we do for infant mortality, you know, SIDS prevention, not smoking, baby sleeping in a crib by themselves, you know, in your room for 6 months with no bumpers and blankets and things like that. But what it is to show you that we have something that is rarely talked about. It's still very taboo to talk about stillbirth. And we want to get to a point where we are talking about this. We are talking about stillbirth prevention techniques, just like we're talking about the Back to Sleep campaign with our patients. And so that's why you're here today. So you can become comfortable talking about this, that you know the tools and resources available to you to talk about this, and that we can change that narrative and we can move away from thinking this is a taboo, we don't ever want to talk about it, to we need to be talking about this. And so again, I think you all know this, but some of the causes of stillbirth from common to least common based off this research study, you know, things like pregnancy, labor complications, problems with the placenta, birth defects, infection, the umbilical cord, and medical complications with the mother. And so let's look at that 23,500. When we look at national data, we know that 1 in 169 pregnancies ends in stillbirth, and the racial disparities are huge. Black women, it's 1 in 96. Black women are 2 times, sometimes 3, depending on the state, more likely to experience a stillbirth over their white friend, counterpart, neighbor. Hispanic, Latinx women, it's 1 in 199. Indigenous moms, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. And so if we dive that down just even further and we look at the Florida data, in 2019, the rate for Florida with stillbirths was 6.8 stillbirths per 1,000 deliveries, 1,515 fetal deaths in 2019. The white rate is 5.2, Hispanic women 5.7, Black 11.5, non-Hispanic Black 11. And you can get all of this data on this website I've linked here. Florida does a phenomenal job of tracking all of this. And so you can go here, you can drill it down by county if you want to see what county, your county is. You all are a little higher than the national average, where you can see right there, that is the US line. That red one is just around 6, a little lower, and you guys were 6.8. So you're almost a point higher. But what I want to show here is, if you look at the blue dot, that is our Iowa stillbirth rate. Count the Kicks was actually created in 2008, where you can see that blue dot is the highest it's ever been for stillbirth rate. And you can see we have been, if you look at that linear, that dotted line, a downward trend in stillbirths here in Iowa. Since the inception of Count the Kicks in 2008, we have seen almost a 32% reduction in the number of stillbirths here in Iowa. We've also seen in the first 5 years of the campaign about a 39% reduction in the number of stillbirths here among African American women. You can see there's some outliers there in 2017, 2019, it kind of fluctuated up again and then going back down. So that's why we really look at trend. We look at 5-year, 3-year averages. We know that data can be year to year. Things like a syphilis outbreak or a pandemic can throw it off and make it increase or decrease, et cetera. And so if you look at our 2020 preliminary Iowa stillbirth rate is 4.0 fetal deaths. So we're on the second lowest Iowa stillbirth rate on record after 2018, and one of the lowest in the United States. And I share this with you because this is what we're bringing to Florida with our partnership with the Department of Public Health there. We want to bring a 32% reduction in the number of stillbirths to Florida. And that's what we're doing. That's why we're having these conversations. We are replicating what we have done in Iowa, what we know that's worked, what we know are evidence and best practices to Florida. And so, as I mentioned earlier, we looked at, the stillbirth data really quickly, and we talked about how Black women are 2 times, sometimes 3 times more likely to experience a stillbirth. And I think it's really important to kind of really highlight that and talk about, why is that? Why is this happening, and what can we do about this? And so researchers point to the following as causes for disparities: systemic racism, toxic stress, years of being treated unequally and or unfairly, essentially being an African American woman in a systemically unjust society, and everything that comes with it has led to real and pervasive health issues for Black women. Epigenetics, those physiological variations that are caused by external or environmental factors, literally changes in the DNA sequence and how cells read them. Predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, high blood pressure, all are linked to maternal stress. And experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers. But research shows education is not a determining factor. A college-educated Black woman is still more likely to lose a baby than a high school-educated white woman. So what are we doing at Count the Kicks to reduce disparities? We always have a laser focus on this. We have hired a health equity coordinator. Her role is to look at what we're doing, to look at our state partners, to find those organizations that align with us, that align with our values, that really focus equity at the center of our campaigns and ensure that we are being culturally competent, continuing to center equity and going through trainings and things like that. We have an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. Based on those funding opportunities, we've been able to improve programming based on lived experiences of women of color, holding focus groups and talking and listening and hearing, and then implementing best practices around that, working within marginalized communities. We also have our app in 12 languages, culturally appropriate material, videos, printed educational, FAQs in multiple languages. These are just a couple of the things. I really challenge you to look at your work and what you're doing, and what are you doing to also to reduce disparities in healthcare in general and around stillbirth. making sure that you're asking, you're listening. When you're talking to a patient, you're on their level, their eye level, making eye contact, repeating after them, emphasizing, make sure you understand exactly what they're asking. Do they feel comfortable? Things like that. So just something to think about. So when we talk about research and evidence, and that this is an evidence-based campaign, this on your screen right now, this is what started it all. This is the research study that the founders, 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s, this is the study that they found out about. They were at a conference presenting on how they received funding to create the first stillbirth registry in the nation in Iowa. That is no longer, unfortunately, due to funding, but they were at this conference, this public health conference, and there, a couple of the founders had heard about a study done out of Norway that showed when pregnant women in this study, when they were educated on the importance of tracking fetal movement while pregnant, that they showed about a 30% reduction in the number of stillbirths among this cohort. And so the founders thought to themselves, that's amazing. This is what we need. We need a prevention educational campaign that gives moms, expectant parents, the tools and resources to understand this importance and to speak up to their providers if they notice a change. And we need a campaign for providers, healthcare, maternal health, to be able to talk to their patients about stillbirth and stillbirth prevention. And so they came back to Iowa, and that's what they did. They created a mom-centered and empowering campaign. They know, as more than some people, because they've all experienced this, how dark and sad stillbirth and infant loss is. And so their one goal in 2007, when they learned about this research, was to just save one baby. If this would save just one baby, their lives, that would matter for the daughters they had lost. And so here we are, over 10 years later, and we've saved over 75 that we know about and more, and we've seen a huge reduction. And so this is truly the research that started it all. I love pulling this quote out that says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. We'll talk a lot about what that means, that normal movement pattern here coming up. So Dr. Ruth Fritz, she's well known in this area. She's also on our medical advisory board, and she was one of the researchers of this Norway study. Some other things that I just wanted to share, if you're thinking, oh, this is just going to increase anxiety in pregnant women, they're just going to be calling me all the time. I actually get questions about this. I have had providers say, does this really work, or is this just going to get a bunch of women, or expectant parents knocking on my door, calling me, bothering my nurses, etc. I say a couple things. One, I show them the research, right, that most research has found that type of increase is not to be true. Usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits, because if you think about it, we now have educated expectant parents who understand what's normal for their baby, for their body, and that they have actual data in their hands, so they can then feel confident going in and saying, this isn't normal. My baby normally can't, I get 10 movements in 15 minutes, and today it took 45 hour and a half. That's not my baby's normal. I know this doesn't feel right, so I'm gonna speak up. We also have a study going on with Des Moines University and the Harkin Institute, some preliminary findings where we literally looked at our app users before and after the use of the app. So the first study of its kind that really looked at stillbirth prevention in the use of mobile health technology. And preliminary results showed that a reduced rate in stillbirth for the pregnancy in which they use the app compared to earlier pregnancies. So becoming aware, understanding what's normal for their baby. And then we also, on our app, we have something called a finished pregnancy survey. This is where, if mom has had baby, she can voluntarily fill this out and ask questions about birth outcome, and ask questions about, did the app make you feel anxious or less anxious, or help you bond with baby or not bond with baby? And did you notice reduced fetal movement, and then what? And 78% of the women that we surveyed from about March to November 2020, I believe it was, more than half made them feel less anxious. So 78% of that cohort. And more than half of the women indicated that using the app helped them bond with the baby. Some other misconceptions, people might think this is going to increase C-sections and other interventions. This is a great study. If I have it all cited here. We have them cited on our website as well, but it says increased maternal awareness of fetal movements by mind fetalness in the 3rd trimester is advantageous for mother and baby. Spontaneous, I can never say that word. The start of labor increased and interventions, notably C-sections, decreased. Fewer babies were born small for gestational age and in need of neonatal care. Women expressed having positive attitudes to the method and feelings of safety and calm when they practice mind fetalness. And we have not seen an increase in the C-section rate in Iowa. And so that quote from that research study kind of hinted at it, but there's other benefits, right? Like if we can catch things early, because mom came in at 32 weeks knowing, my baby's just not moving like normal. You might catch things like preterm birth, babies trying to get born early. What can we do? Maybe, they need bed rest and things like that, or they have undiagnosed gestational diabetes. Fetal growth restrictions are identified earlier. And we also know that women who have stillbirths are at higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. And so truly, due to the low cost and potential benefit, it's recommended. Decreased fetal movement can indicate a need for more evaluation that has the potential to save lives. If you need even more research, like I said, we're very evidence research based. We have a whole webpage dedicated to the evidence. So feel free to take a look. We've been named a best practice by the Association of Maternal Child Health as well. And so we really take this very seriously when we look at our data and our research. And so one video I wanted to play for you was, this is Kim Piper. She is the executive officer for the Center of Congenital and Inherited Disorders at IDPH here in Iowa. She's also the project director for the Iowa Stillbirth Surveillance and Prevention Program. She's a great advocate. She was one of the first people the founders reached out to back in 2007, 2008 that said, we want to do this. We want to save babies. We want to help prevent preventable stillbirths. Can you help us? And she was a previous labor and delivery nurse. So I think this video will speak to you all as nurses as well. And so I just wanted to play so you can hear her thoughts about this.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
So this is a long quote from Kim, but she says, I bolded the part where it says, again, research shows that babies can be saved if expectant parents are educated about tracking their baby's movements and immediately reporting any changes to the baby's movement pattern to their healthcare provider. And I think that speaks volumes because, as labor and delivery or nurses, or you go in and you have a mom and, realize there's been a stillbirth, and it affects you too. It affects everybody that comes in contact with it. And so, I know you're doing this. I know you guys are on the front lines of this, and we appreciate all the work that you do. And so I think you taking this opportunity to learn more on what else you can do is so wonderful. And so with that, I'm going to talk about more of the implementation of Count the Kicks, what Count the Kicks is, the app, and the resources. So again, obviously, if you have not seen the material, it's bright, it's colorful, it's inclusive, it's evidence-based, it's mom-focused, it educates women on the importance of tracking fetal movement through our app, which I'll talk about in a minute, or we also have paper charts. So if you have a population that you work with closely that doesn't use a smartphone or has a lot of issues with Wi-Fi and broadband, we have 3 paper charts available on our website, one in English, one in Haitian Creole, and one in Spanish that you can download and use. And again, it's all about empowerment. It's all about that empowering moms to speak up to providers if there's a concern. Now, one of the things I want you to do that you probably have never done in a presentation knowingly, or like that the presenter has told you to do, is to pull out your phone, actually use it during the middle of a presentation. I would love for you to go into your app store, whether it's the Apple store or the Android store, and excuse me, download the app. Just search for Count the Kicks, excuse me, in the App Store. Sorry, I'm gonna take a drink quick. So once you find it, download it, because I'm gonna push this button, and as I'm talking, it's gonna run through how to use the app. But I want you to download it because I want you to become familiar with it. I want you to be able to pull your phone out when you're talking to an expectant parent and say, look how easy this is. You just tap the footprint every time you feel baby move. Choose one time a day, preferably around the same time you know baby's most active, and start using it. It's in 12 languages. If you don't see language on here that you know you have a large demographic that you would love to see it, let us know. Let us know, and we will work with the Florida Department of Public Health to make that happen. That is exactly how Haitian Creole got on this app. That is exactly why we now have materials in Haitian Creole in Florida. It's because community members spoke up and said, we need this in Haitian Creole, because those are the patients, the clients we serve. Users can restart their session or delete a kick. This is super helpful when you get sidetracked, you're potty training a toddler and you're at home and you're doing your kicks and your counts, and all of a sudden 3-year-old Grayson runs up and says, I gotta go potty. And you gotta go potty, right? Like if you've potty trained before, when they say that, you gotta go, and you're probably too late already. So then you come back and you're like, oh shoot, the timer kept going and I wasn't ready. And so you can undo, you can restart the session if you need to, if you got out of it. You can delete a couple kicks if Grayson runs over and starts tapping the phone while you're looking elsewhere or something like that. You can also set daily reminders. Very, very important to do that, because we are all busy. We were busy during a pandemic, I felt like even though we weren't going anywhere, between hybrid school and online school and working from home and going in, and we were busy. And now that things are slowly starting to open up and things are happening now with our kids and vacations are happening, we're going to get even busier. So reminding mom to set those daily reminders. Really important. You can download history. Expectant parents can use this. They can download the history of the app of their sessions and send it directly to their provider. They can email it, they can text it if they have that type of relationship. We use, I have a My Chart on my phone where I can upload images. They could take a screenshot of it and upload it and say, look at my data. What do you think? Or let's talk about this the next time I'm in. Track future pregnancies. They can manage multiple devices. And soon, we're super, super pumped. We're going to be launching this on Apple smartwatches here within the next week or two. And then we'll also be including a notes section for each session. You can see I've been running the video there as I talk, just to kind of show you how easy it is. This is Spanish right now. It's very user-friendly. I found that a lot of users can use it in English, even if they do speak a different language, just because it's very easy to kind of follow. The icons are easy to understand what they are for. And you can see up there on the right-hand corner of your screen where it shows you the average time and the total time. So what happens is once you start using it, the app helps expectant moms say, okay, baby normally takes X amount of time, and the graph's going to be very visual and very user-friendly to see. So for instance, this user can see my baby usually gets 10 movements around 15 minutes, right? She can see the last session was 15 minutes and 6 seconds. Her average time is 15 minutes and 24 seconds. And she has the dates there at the bottom and everything. And so what this does is show mom, so let's say one day she's counting and it's taking more like an hour to an hour and 15 to 2 hours. That chart is going to skyrocket there. That one session is going to make the chart go way high, like a mountain. And so that would be a visual reminder to say, this isn't my baby's normal, right? This is, I can see right here, my baby's normal from the last 6-7 sessions has been around 15 minutes. I'm going to contact my provider. And that's what it is. It's empowering them to speak up to their provider about it. One other thing that I really wanted to mention here was we are adding a strength component. This is not out on the app yet. It will be released along with the Apple Watch here in the next week or so. But I really wanted to highlight it since I'm talking to you today about it. Research shows expectant parents should also be paying attention to the strength of their baby's movements. At the end of each KICS counting session, they will be asked to rank the strength of their baby's movements from fluttery to fierce. And it has a description of both of those. And there is no necessarily right or wrong. It's not like, oh, my baby always needs to be a 1 or anything like that. It's more for mom to understand that what her strength is shouldn't change, just like the number of, the length of movement. So let's say she's always counting and all of a sudden, she always gets like a 4 or 5 for strength and today she got a 1. That's quite a significant change when she normally has those fierce movements. And if you think back to that Good Morning America video where she said, the mom had said, her movements were softer. They weren't like her normal movements. That's what we're talking about. That awareness, that noticing of baby's movements in strength and time is really important and what we're trying to educate expectant parents on understanding. And so with that, I also have a video of Nancy Travis, who I think she's on the call. She talked earlier. So we love Nancy. We work really closely with Nancy. She is, I'm pretty sure you all know her too, but we will be presenting with Nancy at the National AWHONN Conference here in October in Florida. And one of the reasons Nancy knows so much about Count the Kicks is because she picked up a brochure once at an AWHONN conference a couple years ago. And at that conference, she learned about Count the Kicks, took it back to her location, taught everyone else about it, and saved a baby Dale, which we'll talk about in a little bit. But I have a video over that didn't show on my PowerPoint, so I'm going to try and see if I can show you all. Can you see the YouTube video, Jen?
Yes.
Okay, here's Nancy.
Hello, my name is Nancy Travis. I'm the Director of Women and Neonatal Services at Lee Health, Cape Coral Hospital, and the Florida AWHONN Section Chair. I learned about Count the Kicks several years ago when I was at an AWHONN conference. I brought the information back and my team readily put it into use. A little while after that, we had a mom that noticed her baby's kicks were not what they should be. She spoke up. She came to the hospital. We did an emergency C-section as her baby was in distress and ended up with a healthy baby. We are very thankful for Count the Kicks. It is a simple, easy application that can be used by any new mom. I'm also very excited to be sharing this information with the state of Florida. We'll save more babies' lives together.
Yes, we will, Nancy. Love it. So I had to share that because I'm presenting to the Florida AWHONN, right? And she's on. So thanks, Nancy. Can you see my slides again, Jen?
I can.
Perfect, because Jen's going to talk now for a little bit. So Jen, take it away about how to implement Count the Kicks.
Awesome. Thanks, Megan. And I just love that we got to start with Nancy kind of highlighting the section that I'm getting into. And there's a little bit of review here, but it's important review. I think that one thing that we realize, especially my work with women who have lost babies, they talk a lot about the stigma they feel, a lot about their frustration with not realizing what risks really did exist in their pregnancy. And most of them were low risk. Low risk does not mean no risk. And so it's really important that we use the word stillbirth, that we educate women that stillbirth is real, just like we educate them to take their prenatal vitamins because we want to make sure they get their folic acid, just like we want them to take their gestational diabetes because we know that that is a risk factor in pregnancy. We want to make sure, just like we do for all other preventative health measures, we want to make sure that we are educating women on their risk. And stillbirth, as you just saw statistically, is a risk. I know we don't want to scare moms, and we certainly can have the conversation and talk about prevention, just like we would talk to a mom about having her mammograms. We want to empower them with information. And they are not delicate flowers. They will take this information, and most of them won't need that. So it's an important conversation to have. Stillbirth just happens. There's nothing we can do. Actually, that's not true. There can be warning signs. And catching those warning signs early with kick counting can really make a difference in the birth outcome for moms. So stillbirth can be preventable in some cases. Her baby is always active. It's not a concern. Babies are active until they're not. And it's just really important that mom can identify normal. So if they are not tracking, they may not be able to put a time to that. They may not be able to put words or data to that and having that conversation with their provider. Some health issues are quick. So an active baby can be a healthy baby, but their cord may not be healthy. So we need to know what's normal so that we can have a conversation in a clinical setting with that mom who's now noticing less movement. And so all moms, even moms with active babies, need to be tracking their movement so they can discuss the change in their baby's normal. She's almost at her due date. The risk of stillbirth actually increases as a mom approaches or exceeds her due date. And so that 37 to 40 plus time period is a critical time for mom to know her baby's normal and her pattern so that she can actually decrease the chances for stillbirth at the end of a pregnancy. Misconceptions. I'm going to go through this with Megan. These are really important myths or misconceptions that exist. And it's important to get these out there, to talk about them. And so that's what we're going to do here. And we want to let you know that babies do not move less the closer to their due date, but that's a misconception that's out there. A lot of women that I've worked with talk about this being something they believed strongly and was passed on generationally. So Megan?
Yeah, you're right, Jen. Babies do not move less. They actually just move differently. And you all know this working in this every day is you may feel less sharp kicking and more rolling. However, if you're monitoring the baby's movements at the same time each day, it should still take about the same amount of time for mom to feel those 10 movements.
I can hear baby's heartbeat on a Doppler device, so I don't need to worry about movement.
We know that a change of the baby's heartbeat is one of the last things to occur when a baby's in distress, whereas decreased movement is an early sign. So if you think about it, when you and I are sick or our kids are sick and we just want to lay around and watch TV and lay on the couch or in bed, we don't want to move as much, right? Our heart, is still beating and fine, but we're not moving as much. The same thing happens to baby in utero. If something is not going on that's affecting baby, they're going to be conserving that energy and not moving as much. This is also really important to note when you do have somebody come in with reduced fetal movement, that you're not just doing a Doppler and saying, oh, I hear the heartbeat, that's fine, that you're actually following the protocol of, whatever your clinic has put in place regarding, an NST, if mom notices, you go through all of that processes. So that's just one thing I wanted to mention, but go ahead, Jen.
Baby is just getting ready for birth and running out of room. Again, something I've heard from many, many women.
Yes, baby should continue to move up to and during birth.
Moms should get 10 kicks in 2 hours.
Common misconception and outdated information. What research now states is that moms should be focusing on fetal movement in general and understanding their baby's pattern. There's that, that pattern, that trend, what their baby's normal is when we think back to all of that language that we've been using through all of this. 10 and 2. I know that's easy to say, but what happens then is that as humans, that's what we focus on. We focus on that 2 hours. So let's say I'm counting and I get normally I get 10 movements in 15 minutes, but one day I count and I have in my head 10 and 2, 10 and 2, and I get my 10 movements in an hour and 52 seconds. And I think to myself, that's totally okay because I got it within 2 hours. That's the goal, right? Or 10 and 1, same thing, right? No, we want them to understand what is their baby's normal movement pattern? What is that trend? And the app can help them see that. And so that's what we wanted to share. There's a research study on our website about this too, if you'd like to view, or have the PDF as well. But yeah, so next misconception.
Only high-risk expectant women should do this.
No, all women should do this. We don't only do the glucose test for high-risk women, and a lot of women who do have stillbirths have no other risk factors.
Triage doesn't need this information.
And this goes for labor and delivery and just normal ER. We know labor and delivery is the perfect place to have this information. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home. So Nancy and I and another nurse are working on best practices around this and gold standard. And so we will be presenting all of that at the October conference, but we'll be sure to share it with all the AWHONNs across the nation. You have an opportunity. When I know from personal experience, I went into triage at least 3 times with my daughter for just various reasons in general, not necessarily around reduced fetal movement, but when I got sent home, baby checked out fine each time. Not once was I ever talked about fetal movement, right? And that would be a perfect opportunity as I'm waiting there to be discharged and sent home. I get my after visit summary, all of that can have fetal movement monitoring included in it. You guys have the opportunity to talk with the powers that be that make those decisions on your Epic or whatever, electronic medical record you're using that can add that in.
And this is a very big misconception. Drinking cold water or juice is recommended to get baby to start moving.
Yes, an evidence-based clinical guideline for management of women with decreased fetal movement has emphasized that advising women to drink water or eat sugary foods has no basis in evidence and actually may delay women from seeking fetal well-being assessment. If you think about it, why are we encouraging women to do this to get baby to move? It's not like you and I, when we're not feeling good and we're like, oh, you should just drink a shot of energy drink and you'll be fine. We don't want to create something to make them move, right? We need to, if they notice a reduced fetal movement, they need to be seen right away. So
just reiterating, when do we talk about count the kicks? Well, if it's a high-risk pregnancy, 26 weeks is when the recommendation is to start kick counting. And that is just based on when baby is able to establish a more regular movement pattern, and 28 weeks for a non-high risk pregnancy. And just remembering when we talk about risk, low risk does not mean no risk. That's why every single mom needs to be educated on kick counting, not just high risk moms. Where can you do that? There are countless opportunities, whether it's in the clinical setting or, like Megan said, when you release a woman from labor and delivery triage, but there's also, where else can you put that? Childbirth education classes, breastfeeding classes, daddy classes. We know that partners in these pregnancies are really important. And our most recent Iowa Baby Safe, the dad's strength of encouraging mom to trust her instincts was actually pivotal in getting that baby here safely. So the whole family unit is a part of that educational process. So find those times, those opportunities, and certainly make sure that you're having that conversation at the beginning of the third trimester. Just giving someone a pamphlet at their, welcome to being pregnant in the first trimester appointment, you give them a pile of information and stick information in about movement is not going to be enough. This conversation should be happening at every appointment in the third trimester and certainly be reintroduced at that time. How you ask your questions is pivotal. It is important. We cannot ask, is your baby moving? I have heard story after story of moms saying, they asked me and I said, well, yes. And the conversation moved on and an opportunity was missed to learn what was going on with baby, and the birth outcome was negative. So we need to ask open-ended questions. We need to make it conversational. We need to give mom an opportunity to learn. If she can't answer those questions, why can she not answer those questions? We don't want to make large assumptions about what our patients know and understand. We want to make sure that we provide that education so that everyone's on a level playing field. Mom is going to do the best she can, but we need to know that not every mom comes into the room with the same life experiences, the same education levels, the same knowledge about pregnancy. So talk to mom, get eye to eye with mom. Body language matters. When you have a conversation, you're telling someone how important it is to you if you're making eye contact, if you're having a serious conversation with them. Many moms will say, they ask if baby moved, but that was one question, haphazard, and that was it. And so I just assumed it wasn't that important because nothing, they never stopped looking at the computer and charting. So body language, eye contact, really having that conversation. Share what movements they should be counting, jabs, rolls, pushes, anything but hiccups. So hiccups are an involuntary movement, so we don't want to educate moms to count those hiccups. And that's something, again, women may not innately know. We have to educate them about that. Give moms permission to speak up. How do you do that? First of all, it could be as simple as a sentence. If you are ever concerned or are unsure, we're here. Hospitals, doctors' offices are here 24/7. There's someone that wants to talk to you about this. If you can't get a hold of someone, we want you to go to the hospital right away if you have a concern. If you leave a message and you don't get a phone call back, it's important that you go. Just giving moms permission to speak up, telling them that you're here for them, that you want to hear their concerns, could be the most important sentence they hear in that conversation. How do they get a hold of you? Educate them on that. What's the phone number they should call? What's the process they should expect? You know, all of those conversations may seem obvious to you because you're working within that day in and day out. It is not obvious. And a lot of women don't want to be a bother. They don't want to be an alarmist. They don't want to believe there could be something wrong with their baby, and they'll talk themselves out of it. And so that's really important part of your job, is having that conversation and giving them permission. Share the Count the Kicks app. If you have it on your phone, pull it out, show them. It's so easy. If they're waiting to get their glucose test, which is, right there close to that third trimester, this is a perfect time to have them download the app and get started in learning how to use that so they can start tracking that movement at the 26 or 28 week mark.
Great. So let's watch a video about that.
So here's some information about Count the Kicks. It's a program in the third trimester that helps you keep track of the baby's movements and make sure the baby's moving enough. The little card is a card to download the app. So you can put it on your phone and you can track the baby's movements and make sure that you're getting your kick counts in the day. This pamphlet goes through some information about the program, tells you kind of about the goals. The goal is for you to learn your baby's movement pattern and so that you can detect any change in that pattern and report that to your doctor. So do your kick counts each day, and if you feel like you're not getting your baby to move as much, I want you to either call the doctor or go to the hospital and get checked out. Sounds good? Okay. how's the baby been moving?
He moves all the time.
Great. Have you been using your Count the Kicks app?
Every day.
Awesome.
Counting kicks in your third trimester is really important. So I want you to take out your phone and I want you to download this free app from Count the Kicks. And when you've got it, you can open it up and you're going to track your baby's movement. When you feel baby kick, you're going to hit the kick button and it's going to be able to track movement so you can have good conversations with your doctor.
Hi. Yeah, I was hoping to speak to somebody. I'm getting pretty concerned. I've been doing my Count the Kicks and I just don't feel him move like I usually do.
Okay, well, let's have you come in today and we'll get you checked out, okay?
Okay, so I can head into the hospital? Okay, thank you so much. Yeah, my doctor's office sent me. They're concerned because baby's not moving as much.
Okay, let me get you registered here, okay?
Hi Kayla, how are you? My name is Amy. I'm doing your ultrasound today. How's your pregnancy going for you?
Good.
Yeah. Child on your belly?
Will I see it up on the TV?
This is your baby heartbeat.
Would you like to read together?
Great. And one thing about the video, you'll notice the app looks a little bit different if you've downloaded it, which we hope you have or you will. And so that video is a little bit older. The app is actually a little bit different today. So one thing I always want to point out is it really is helpful to providers and to nurses to get a phone call. And here's the difference in the dialogue that the app can create for you. The difference is this: a mom will call and say, I feel like my baby is moving less. Right away, that word feel is tied to an emotional feeling. It's not very easy for a nurse or a doctor to grab onto. Why do you feel that way? You know, what is it? You know, there's just a lot of probing questions. Now imagine mom calls you and says, I know my baby's movement pattern has changed because my baby's normal is 10 movements in 10 minutes. And I've been trying to get movement for my baby and it's taken an hour and a half. That's a significant change. All of a sudden you have something quantifiable, you have data, you have something that actually gets you to best next steps. And so I think that it really does empower moms to know their baby's movement and to have that conversation. And it gives providers and nurses a lot more information that they need to make the next best steps and decisions. Talking to moms who've had a previous stillbirth, this is hugely important. There are some things here that I think that are really important for each of us to take back into the conversations we have with lost moms. First of all, recognize that if they are in a rainbow pregnancy, whether it's their 4th pregnancy or their 2nd pregnancy, they are going to be anxious. They've had a life-altering, traumatic, very difficult experience. And so let's not make anxiety the elephant in the room and dismiss it, but just acknowledge that this is going to be hard, and we're going to work together, and we're going to have that conversation. We want to make sure that we follow the same protocols for moms when it comes to kick counting that have had a loss. A lot of these women now are going to be very, very educated about what happened to them and the next things that are to come. And so we want to make sure that we recognize that they are in a high-risk pregnancy. They will know that, and we want those moms, if you've had a stillbirth, you are at higher risk of having another stillbirth. And we want those moms to start counting their kicks at 26 weeks, although many of them will already be counting kicks by the time you have that conversation with them. Really, really important in how you talk about that. Please do not ignore that they lost a child. Please acknowledge that child with the proper pronouns. It is not an it is a he or a she. Please make sure that when you're having that conversation, you use that baby's name, especially if the mom references that name regularly. If you were not a part of that process for the loss, that is a conversation you need to have, but you also need to acknowledge that the rest of the staff in your office needs to read that chart and not ask the same questions over again, and make that mom have that conversation many times to be aware of that, and to also get rid of the stigma around it, that there's no blame. They're going to be hyper alert to potentially, or have guilt potentially about why their baby was lost. If they hadn't been kick counting before, they are going to want to kick count, but may feel badly that they didn't do it for the child they lost. That child is a sibling, it is a grandchild, it is very important to their family unit. So please stay away from medical terms like fetal demise, and just practice general humanity and empathy when talking with these moms. If anyone has talked about the importance of tracking fetal movement with them before, is an important question. Do they have this knowledge? Again, starting out with not assuming anything, and just make sure you have fetal movement tracking conversations with, again, lost moms who are higher risk for a second stillbirth. So first of all, congratulations, you're already getting started on the implementation of Count the Kicks. You come to us maybe with different settings, whether you're a nurse in a clinic or in a labor and delivery triage, or you're a nurse educator, which is a hugely important role to spreading Count the Kicks awareness. We want you to familiarize yourself. I don't think, we've said it several times, but I don't think we can say it enough. The app is super easy. Get familiar with it. Why our app and not another app? We are completely evidence-based. We are, like you said, adding strength. Megan was telling you about adding the strength component based on research. And so we want to make sure that that Count the Kicks app is a tool that you're comfortable with, so you can educate those around you. Order our materials. We hope that you flood our order box with material orders. You saw in those videos ways that you can put those materials into practice. Put them in the bathroom, put them where they're glucose testing, put them in a clinical room. You can hand brochures or app cards to encourage mom to download the app. So get your materials at www.countthekicks.org. Just go to order materials, go to the great state of Florida. They're completely free, thanks to the wonderful partnership by the Florida Department of Health. And, use them. They are bright, they are cheery. We've tried to make stillbirth a conversation of importance, but not a dark, heavy cloud. And so help us break that silence on stillbirth and educate and empower women with those materials in the app. Review sample course materials. We do have a CE training that's 1.5 hours if you choose to take it. Again, this is not going to qualify you as a CE training, but you can take that. And those are free from the Department of Health, and we would love to see you take those. And we also have many resources on our website For implementation, the Provider Academy would be a great tool to go back through and see how all the tools and videos and education that you can gather and utilize. Make sure your entire team knows about the campaign and the importance of tracking fetal movement. This needs to be a whole office or whole triage centers practice. And so even the person that's answering the phone needs to know that when a mom calls with a concern, that needs to be prioritized appropriately and get to the right person, and that mom should not be waiting a long time to receive the information she needs about next steps. And integrate it into care plans and touch points. Make sure that if you can in your electronic charting, have it in there. If you have it in any paperwork, whether it's discharge paperwork at a labor and delivery or any type of literature that you may have at your office, make sure that you are integrating Count the Kicks into that process. And that's that systems change that Megan talks about. So a few extra notes here. Stress to parents to trust their instincts. That important conversation I mentioned earlier. If a mom feels concerned that something isn't right, call the doctor. Mom's intuition does matter, and how she feels about her pregnancy is an important component. One of our ambassadors will say, you know, when you have a child, you'll be advocating for that child all of their life, and that advocacy really needs to start in pregnancy. And the mom is really the only one that can give providers and professional healthcare providers the information they need to get that baby here safely. And so make sure that you encourage that conversation of trusting their instincts and contacting you. Share that sleeping or lying on their left side is best for them and baby, and kind of going along with that when kick counting, if baby is, we said once a day, when baby, you know, is normally active, we even encourage that to be in the evening. Research does say that babies that are active in the evening are healthy babies, typically. So that evening time is a good time for them to lie on their side and bond with that baby. Our studies that we've done on our app, the surveys that we do with our app users, one of the most beautiful things is most of these women don't need it to save their baby's life. But they still have that time to spend with their baby, get to know their baby and their baby's habits, and dream with their baby and bond with their baby. And that is a really important next step into delivering a healthy baby and taking it home, having that bond established. Review common myths. So what Megan and I went through, those misconceptions, it's really important, especially if someone's living in a multi-generational home. It's really easy for other women to share those myths, those wives' tales that they were told, like, oh, baby will run out of room at the end of pregnancy. A lot of that is shared generationally. And so it's really important that you debunk those myths early on in the pregnancy and not wait to have those conversations. So next steps, download the app. I think we've said it a few hundred times today. Practice, practice, practice. It's super easy. I've been testing the app with Megan to get ready for the strength component. It's really quite user-friendly, delightful. It's fun to look at. It has baby save stories. Who doesn't want to hear the wins? And so make sure you share this information with all your staff, order materials. We hope you're going to do it today. And if you don't have someone designated to keep materials, important educational materials in your office, do so. That way you know that your supply will always remain. Of course, that can be found at www.counttthekicks.org. And why can we give you these materials for free? Because of the great Department of Health, Florida Department of Health's partnership, providing those materials for free, for believing in us and supporting the awareness that Count the Kicks is bringing to save Florida babies. I'm super excited to tell you that Casey Omeki is a contact that you can always reach out to. I'm sure Nancy Travis also loves to be a resource. And so make sure if you have any questions or ideas or want to have a webinar done or a presentation done, that you contact Casey and let her know.
Great, thanks, Jen. Oh, go ahead.
Go ahead, Megan.
Yeah, I was gonna just say, I know we're at limit, so if you guys need to hop off, feel free. We'll keep going. And again, this will be recorded, so you'll get the recording. And so just really quickly, we'll start wrapping things up. But other ways to think through integrating is using a form at check-in, having all front desk staff trained to ask patients to fill out this form. It looks something like this. We're piloting this right now. So if you want to be a clinic that also pilots this, where you work in a clinical setting where you can have everybody in the third trimester just fill this out, have the nurse hand it to them, or front desk staff. We'd love to work with you on that. Like we said, including a question on the EMR that pops up in the 3rd trimester to remind you to ask about fetal movement using that notes section. Here is an example of a community-based organization in Ohio that they talk to about 2,000 expectant women every year through their funding here at the City of Columbus, called Celebrate One, and they added a question about, have you downloaded the Count the Kicks app, yes or no? And then we worked with them on verbiage around how to educate and talk about it with their clients. And so super simple stuff like that is really easy to do. We'd be happy, like I said, my passion is workflow change, systems change to make it easier for you. So this becomes something that you don't even have to think about, right? Like I could be in a grocery store and somebody, you know, I could strike up a conversation and clearly tell she's pregnant, right? You always got to be careful there, but you know, and talk about it. Like, have you heard about this app and things like that? And so just think through things about that, of how you can easily integrate this. And so Jen is going to talk to you a little bit more detail about some of the resources we have to offer you for free.
Yeah, thanks, Megan. So here's an example of that Haitian Creole poster. It's a promo poster. So we have those posters in English, Spanish, and Haitian Creole for free to you in Florida. And we have how-to posters that actually line out the steps of how to count the kicks. App cards are basically like business cards, but an easy way for you to hand a mom that reminder she needs to download the app. And then our educational brochures, which again are not real medical heavy. And so it's really made for moms to educate them and empower them. So order those today and we'll go to the next slide. Additional materials, you can find all of these at countthekicks.org, and they are free in the state of Florida. We do have low literacy materials, again, that recognizing come with different needs, whether it's language barriers or ability to read. And so these are very visual ways to educate women who may have those barriers, and they also come in Haitian, Creole, Spanish, and English. You can take that wonderful CE training we mentioned with the Save Babies-Florida free code, thanks to the Florida Department of Health. And there are state-specific websites, both on the Count the Kicks website. You can go there and track and see how Count the Kicks is spreading in your state. The Florida Department of Health on their website also has a Count the Kicks specific page as a resource to you.
Yeah, and I'll include all of these in the email that you'll get, so you don't have to like frantically write these down. I'll include direct links for you all.
So one of my favorite parts about my job is I get to work with our Count the Kicks ambassadors. Who are they? They are trained, highly invested volunteers committing to preventing stillbirth in their communities and state, and usually as a result of their own life experiences. We have 42 women, and 33 of them come to us as loss moms that have lost babies to stillbirth. But we also have moms who have saved their babies using Count the Kicks education and awareness, and they are powerful and passionate supporters as well. They are trained, and I want to highlight that before an ambassador goes out and speaks in their community. We ask that they also take that CE training, and they go through trainings with us as staff. And oftentimes just their life experience requires them to be, they might be digging into research and learning on their own. So they are trained and high level volunteers. They can do a variety of things that might support the work you're doing. They could do a training like this. They could go to baby fairs in your area to help educate women. They could give interviews because we know PR works. Back to the Good Morning America story and how our awareness spread, and we saw that in the download of our app. They can work to grow partnerships in their own backyards. Organizations perhaps that are already building wonderful bridges and working with marginalized communities, and they could be right there in their own community. Our staff can't do it all, but our ambassador team makes it feel like we can do so much more. And this is just a picture that shows you the states that do have an ambassador, and yay, Florida does have a lovely ambassador named Sarah Seriani. And Sarah is a baby save mom. She saved her son, Ryan, who was her third son. So we're excited to have Sarah. So We would love to see all that go yellow. We have baby save stories on our website. This is why we're here, folks. These are living examples of babies that were saved because their mom had a conversation in their doctor's office and were educated to kick count. And Nala, Eva, Everett, and Luna are beautiful examples of that. Eva's mom, Yelly, says, I am very grateful that Count the Kicks made me aware of the importance of paying close attention to baby's movement, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all expectant moms out there. Happy and healthy deliveries to everyone. And that was the State Department in Kansas, the Department of Health there was responsible for getting that information in their state, and baby Eva and Yelly get to celebrate with that lovely save. We had one, and Nancy was a huge part of baby Deo. And so his story is on our website, but again, mom was educated by Nancy, taken seriously. Baby was in distress and got here safely. And he is now a very active little boy. I believe he's 3 or 4. So, and a big brother. So very fun to see Deo.
That's what I was just gonna say. I believe he's a big brother now. So exciting.
Yeah, yes. And then connect with us. We are on all the social media channels, Facebook, Instagram, Twitter. Lots of education comes through those channels. So we encourage you to also go to our website and sign up for our newsletter so that you can keep learning about the ways that we're growing in your state.
Awesome. All right, thanks everybody. I'm sorry we went a little bit over, but it looks like y'all stayed on, so that's exciting. And we're happy to answer any questions. You're muted, so you have to use the chat. You can say I have a question, I can unmute you, or you can just ask it via chat. Or if you don't have any questions, great, go ahead and log off and go about your day. I hope you have a wonderful, wonderful day. We're so excited to be here in the great state of Florida. Love the Dr. Seuss look to the materials. Yes, it is very Dr. Seuss-like, isn't it? Awesome. How do you get your state to support this? You must be my PA gal, right, Kim? We'd love to talk to you more about this, Kim, of kind of the process. It's really, it's really helpful to have a contact within maternal health in your Department of Health. And I know we do have a little bit of a history there where we've reached out a couple times, but I think showing support that you want this there as a constituent is really important. And so if you want to email us, here is I'll put it in the chat. Email me and we can talk about it a little further. I can connect with you on a little bit more of what we have done in Pennsylvania. We have had moms contact us before, lost moms, that say, why is this not here? Like, why didn't I know about this? Like, why is this happening that nobody told me about this? And we want to change that. Why didn't I know to I'm so glad I know. I'm so glad that they told me about this. And so I'd love to talk to you more about that, Kim, to get there. So Kim, feel free to contact me, and I'd be happy to send you just a sample of materials too, so you can use it where you're at while we work to get Pennsylvania on board, because that would be amazing.
And we do have a wonderful baby safe story, baby Olivia, and so she is from Pennsylvania. So there's the difference in a mom having the tools she needed at the right time in your state.
Yeah. Yeah, thanks everybody. Anything else? All right, well, if not, you can log off. Kim, feel free to email me your address and we'll connect that way. Thanks everybody. Have an awesome day.